Suicide is a major public health problem with social, emotional and economic consequences. And that's why at the start of Suicide Prevention Month, GibSams has organised an event to get us all talking about it. They want to change the narrative.
Changing the narrative about how we speak about mental health, mental wellness, suicide. We want people to feel able to speak about suicide openly. Looking around you, with your friends, your colleagues, your family members, if you're seeing some changes in their behaviour, it's about what does that mean? And actually not having the fear to have those conversations and ask those questions.
Nobody, apart from if you've gone through this, will know how suicide affects you. Mine was very close with Alan and his wife. It was actually my ex-husband, but we're very close. I thought he was getting there, he was recovering with help, but I missed a lot of signs, and a lot of guilt lies on me because I feel I could have done more for him.
I lost my wife, Veronica, in May of last year. A couple of years before that, she had been diagnosed with motor neuron disease, which only has one result, and it's an awful, awful disease. And once she reached the point where she had lost her dignity, then she chose to go out on her own terms. And in the group, we just share our stories, share how we're getting along. I used to say I have good days, bad days, and really bad days. And now I have less really bad days.
I'm glad to hear that.
Yeah.
But days like this just bring it back as if it was yesterday.
Yeah.
There is always help, and the 111 mental health crisis pathway that's now in place, I think has been a major development. I think another really positive story, as demonstrated by today, is the amount of collaborative working that's happening. We've got 13 students starting this month on their mental health nurse training. So that is fabulous news that we are developing and growing our own workforce.
It's very, very important to get the prevention side in as early as possible so that we build strong and resilient young people so that hopefully they don't come to a time when they feel it necessary to take their own lives. But we're also very concerned about the support that's needed for the young people who have bereaved due to suicide. So the siblings, the sons and the daughters and the nieces and nephews who have lost somebody due to suicide. So we want to get that support in with them as soon as possible so that they don't repeat the cycle.
We have a wide range of opportunities that will be good for character building. It's good for group settings. They can develop a lot of problem-solving skills, and just being part of a larger network will be good for young people's well-being.
There's not a sole individual service that tackles suicide prevention on its own. Suicide prevention is a multi-agency collaboration. And the more services speak to one another and the smoother the channels of communication, the better the outcome for the patient. I'd like to voice as well our 111 crisis line that's still up and running. So if anybody is feeling alone or feels they're in crisis, please reach out to us.
During our live broadcast, one of our listeners got in touch to tell us that there are a lot of well-meaning people in our community, but the reality, they say, is that the system continues to let some people down, with devastating consequences.
I think we have to focus on getting a system in place which actually works, an efficient system which works well most of the time, 99% of the time, rather than what we have now, which I think is still patchy in places where things can go terribly wrong at times.
No health service is perfect, and we're here to learn from mistakes or opportunities that were missed and celebrate successful episodes with our patients as well. It's not all just daunting.
Ultimately, suicide is born out of despair. But the people, organisations and charities that we've spoken to today are full of hope that we can do things better as a community, and they're asking us to talk honestly and frankly about suicide prevention.